Welcome to ASHP's Getting Started in Aseptic Compounding. Today we're going to explore the basics of aseptic compounding.
In this program, we'll demonstrate the importance of aseptic compounding, take a look at its fundamental techniques, and describe and explain the equipment most often used.
As you'll soon see, aseptic compounding can be an interesting, challenging, and important part of your job.
So let's get started.
First of all, what is aseptic compounding, and where and when is it required? Now, have you ever been in a hospital and noticed a patient receiving medication through a thin tube leading into his or her veins? This is an intravenous or IV admixture and is prepared in the pharmacy using a special procedure known as aseptic technique.
Aseptic technique is required when you prepare medications that will eventually enter a patient's body through the veins, muscles, spine, or eyes. These medications are sterile preparations and must be kept free of bacteria, fungi, and viruses.
Patients who receive IV medications are more susceptible to infections than the rest of us because they're already sick, which is why we use special procedures and precautions when compounding IV medications. Now, these procedures and precautions make up aseptic technique and help minimize the risk of microbial contamination from pharmacy-prepared sterile medications. In addition, there is a national standard of practice endorsed by ASHP, dictating the principles of sterile compounding, called USP Chapter 797, or Pharmaceutical Consideration Sterile Preparation. USP Chapter 797 specifies the proper equipment, clothing, and facilities for aseptic compounding.
In December 2007, the United States Pharmacopoeia, also known as USP, released its revised Enforceable National Practices Standards for Sterile Preparation. The chapter provides minimum practice and quality standards for compounded sterile preparations, or CSPs, of drugs and nutrients based on current scientific information and best sterile compounding practices.
The objective of this chapter is to describe conditions and practices to prevent harm or death to patients that could result from microbial contamination or non-sterility, pyrogens or chemical and physical contaminants, and ingredients of inappropriate quality in compounded sterile preparations, or CSPs. Now, you'll learn more about this topic from your instructor later in your studies. Right now, it's important to remember that the goal of Chapter 797 is to protect the patient.
Inside a facility, the space set aside to perform aseptic compounding is called a clean room or buffer area. This area should be away from the flow of traffic, and only specially trained personnel are permitted entry into this workspace. The humidity, temperature, air quality, and cleanliness of this environment is controlled through an air filtering system and employee work practices. This is meant to reduce the risk of environmental contamination to the compounded sterile preparations.
ASHP endorses compliance with USP Chapter 797 and provides educational and training materials so supports technicians responsible for compounding sterile preparations. USP Chapter 797 establishes 3 contamination categories for CSPs based on the potential for microbial contamination. These categories are also referred to as the 3 risk levels: low, medium, and high. Low-risk CSPs are compounded under all the following conditions and, as a result, are at low risk of contamination. Low-risk CSPs are compounded with aseptic manipulations entirely within ISO Class 5 or better air quality, using only sterile ingredients, products, components, and devices. To prepare the low-risk CSP, compounding involves only transfer, measuring, and mixing manipulations using not more than 3 commercially manufactured packages or sterile products, and not more than 2 entries into any one sterile container or package. For the low-risk CSPs, manipulations are limited to aseptically opening ampules, penetrating disinfected stoppers on vials with sterile needles, and transferring sterile liquids and sterile syringes to sterile administration devices, packages, or containers. The storage period for a low-risk level preparation cannot exceed the following time periods in the absence of passing a sterility test. Before administration, CSPs are properly stored for not more than 48 hours at controlled room temperature, for not more than 14 days at a cold temperature, and for 45 days in a solid frozen state.
When CSPs are compounded aseptically under low-risk conditions, but one or more of the following conditions exist, the CSPs are categorized as medium risk of contamination. For example, multiple individual or small doses of sterile products combined to prepare a CSP that will be administered either to multiple patients or to one patient on multiple occasions. Another example is a compounding process that includes complex aseptic manipulations other than single volume transfer, or if the compounding process is of unusually long duration. For example, if additional time is required to complete dissolution or homogeneous mixing. Remember, for a medium risk preparation in the absence of passing a sterility test, the storage periods cannot exceed the following time periods. Before administration, the CSPs are properly stored and are exposed for not more than 30 hours at controlled room temperature, for not more than 9 days at a cold temperature, and for 45 days in solid frozen state.
High-risk level CSPs compounded under any of the following conditions are either contaminated or at a high risk of becoming contaminated. They are non-sterile ingredients, including manufactured products not intended for sterile routes of administration. Compounding personnel are improperly garbed and gloved. Preparations containing non-sterile water that are stored for more than 6 hours before being sterilized.
And finally, if any of the following are exposed to air quality less than ISO Class 5 for more than 1 hour, they are considered high risk. Sterile contents of commercially manufactured products, CSPs that lack effective antimicrobial preservatives, and sterile surfaces of containers and devices for the preparation, transfer, sterilization, and packaging of CSPs.